Lips are a very important feature on people's faces, and they're one of the major things that we look at when we look at someone that tell us their youth, their health, and their fertility. When you look at someone's face, you can't help but look between the triangle of their two eyes and their lips, and so it becomes a major feature of someone's face. The lips also are the only visible sexual organ on the body, and so because of that, there are all these other connotations that lips have that make it a very complex feature on the body. As we age, we lose volume and color from our lips. We tend to lose the differentiation, the lip line around the edge. We lose the volume and the body of the lip. The lips also will tend to turn inward slightly, and there'll be less lip on show, particularly in the corners of the bottom lip. And then the quality of the skin over the lip often changes from a red, fleshy, moist tone of youth to a drier, pinky white, more keratinized version of the lip, which is what happens as we age. This is partly due to the aging process and also partly due to sun damage that happens over the course of our lives. There are several things you can do with the lip. You can improve the volume of the lip. You can also improve the skin quality or texture of the lip as well. A lot of the volume loss that happens in our skins as we age is loss of a substance called hyaluronic acid. Hyaluronic acid is a naturally occurring polysaccharide or sugar molecule that we all have in our bodies, in our skins, in our joints. And one of its functions is to hold moisture around the outside of the cells. So it's part of what we call the extracellular matrix. As we age, we tend to lose hyaluronic acid out of our skins, out of our lips, out of our joints. Probably the main intervention we have with rejuvenating lips is hyaluronic acid fillers, and we can inject hyaluronic acid into the lip to restore some of this lost volume and lost moisture holding capacity. That can be done in several ways. If there are significant lines around the outside of the lip in what we would call the lip blanket, these can be injected individually with hyaluronic acid to erase those and replump the skin. The edge of the lip or the vermilion border can be reconstructed to give a crisper lip line, to make it a more defined lip and also make it more easier for women to put lipstick on. And then the body of the lip, the red part of the lip, can be injected with hyaluronic acid to replump it and to also act like an injectable moisturizer to keep the lips in a moist, reinflated state. The surface of the lips can then also be treated with laser resurfacing, and that can be used to improve the quality of the mucosa or the surface of the lip so that it's not so dry and cracked. This can also improve the color of the lip as well to give it more of the red appearance of youth rather than the whiter, more pale appearance of age. Platelet-rich plasma can be used in combination with both of these things, in combination with filler to add to the effect of the filler, or in combination with a laser resurfacing procedure to aid in the healing and to stimulate a better result from that. Platelet-rich plasma, or PRP, is blood that's been prepared in a way to extract the red blood cells and concentrate the platelets somewhere between about 2- and 5-fold. Platelets are little sticky cells in the blood that are involved in wound healing, and when the body is injured, the blood clots at that site and the platelets get stuck in the blood clot. And what we now know is that the platelets then release growth factors, and that these growth factors cause other stem cells to be attracted to the area, then differentiate into collagen producing cells, blood vessel producing cells, and skin producing cells, and then upregulate and start to heal the wound. So platelets are the cells that initiate and govern the wound healing process, and they're now used in many areas of medicine. Cosmetically or aesthetically, we can use them to rebuild and boost the skin by thickening up and improving the production of collagen and elastin fibers. It depends on what the major issue is with the lip in the first place. If someone has significant volume loss in their lips, or if they have a thin lip in the first place and they want a bigger lip than they ever had, then putting in a filler is necessary to re-put that volume, and that becomes what we would call an augmentation, not a rejuvenation. So that's the same idea as someone who wants bigger breasts, who's born with a small breast, having a larger implant put in. So that is actually making the lip more than it was. But for a lot of people, they're happy with basically the size. They've had good lips in the first place, but as they're aging, the lip is deflating to some degree and the surface is becoming pale, dry, and cracked. In that situation where the person is not looking to have bigger lips, but is wanting to have their lips rejuvenated or made to be in keeping with the rest of their face, then a combination of laser and platelet-rich plasma can work very well to improve the quality of the surface of the lip, to re-plump it, but not to make it anything that it wasn't before. So if you wanted a lip that was bigger or different in some way to what you had before, you would need to use a hyaluronic acid filler. But if you're just looking for surface rejuvenation to improve the color, the quality, the texture of the lip, then platelet-rich plasma and fractionated CO2 laser work very well in combination for this. If we're injecting filler into lips, the normal procedure would be to put a local anesthetic cream onto the surface of the lip first for 20 minutes to half an hour prior to this. Most fillers nowadays are formulated with a local anesthetic in them, and it's usually not necessary for us to use dental blocks like we did to completely numb the lip. That also makes it much easier to inject because dental blocks change the shape and the function of the lip and makes it harder to inject. So putting filler in the lips takes anywhere from about 15 to 30 minutes, depending on what the procedure is. For platelet-rich plasma and laser resurfacing, it's a fairly quick procedure, but with platelet-rich plasma, we need to draw blood, separate it in a special separating tube to separate out the red blood cells from the platelets. We then take that concentrated platelet solution and inject that back into the lip itself, which can be a little uncomfortable and can cause some temporary swelling. We then laser the lip as well, which can cause some more swelling. And then so the whole treatment time is somewhere approximately, once again, 20 minutes to half an hour. The lips will then be quite swollen, but that will settle down over a day or two. The lasered areas will then crust up and become rough for approximately 2 days, and then they will peel. And within about 5 to 7 days, the lips will be back to as they were, better than they were before. The swelling and any post-treatment effect will have gone. Normally in that situation, I would just use a topical local anesthetic cream, and we would leave that on for approximately 20 to 30 minutes. Because the lip is a mucosa and has a thinner surface, local anesthetic creams work very well in the lips. There is still some discomfort. If the discomfort is too much, we can also use nitrous oxide or laughing gas for this procedure, but if the patient wanted to feel no pain at all, then we could use dental blocks, nerve blocks, which will produce complete numbness of the whole mouth area. But we try to avoid this because that is a somewhat unpleasant feeling for some people, and it means that it takes longer to recover from the procedure.